We are in July 16th, actually, selecting your healthcare provider. So an overview, Saturdays on Zoom, our 6 webinar series. June 4th, we looked at your rights to excellent healthcare and healthcare provision. June 25th, the last session was communicating with providers. This session is selecting and working with healthcare providers. Our August 6th selection, feeling safe and valued as an individual in the patient-provider relationship. And August 20th, the last one, managing mental health. The last session will also might be subject to change depending on events that have yet to occur. Today's session, choosing your healthcare provider, we'll look at selecting a provider you can work with, who respects you and responds to you as an individual, your right to change providers if it doesn't work out, and how to learn about a provider before signing on with them. And lastly, how to identify cultural self-care elements if your provider doesn't know them or isn't aware of what you mean by that. And we will be exploring what that means. Part of the reason we have had this seminar series is to address health equity issues and discrimination within the healthcare system and relationships. So I'm Mark Harris, Health Equity Coalition, Out of the Box Health Equity Coalition. Our patient panel is also made up of providers. So Lenora Johnson, who is a therapist in private practice, and Kyle Rodriguez-Hudson, who is also a therapist and executive director of Transponder, and our presenter, followed by our presenter, Dr. Alexander Revelist, who is a licensed psychotherapist. So we are going to present the panel, have a panel discussion, followed by Dr. Revelist's presentation. And I want you to keep in mind, if you will, what did you learn today that you wish you had known before? And what are you going to do with some of the information presented today to do things differently next time you need to choose or continue a relationship or improve your relationship? Just to give thanks to the NAACP Training Committee, Lee Blivens, T.C. Dumas, Adria Godin-Bynum, myself, Damon Hawkins, Terrence Killian, Marissa Lovell, Alexandra, who's presenting today also, Susan Schroeder, Elaine Walters, who you've met, Jocelyn Wenzel, and Renee Yandel. So far, let's see. So I'm only seeing Kyle. Ah, there we are. Okay, great. Thank you. Lenora, can you tell us something about your experience with choosing a healthcare provider, a story you have to share about what went well or didn't go well, an example of when self-advocacy, using your own power, worked to bring about better outcomes? We'll leave it there for now.
Well, thanks so much. So again, my name is Lenora Johnson, and I have been in Oregon for about 3 to 4 years now. And coming from a big city like Detroit, we always have providers that look like us that we can kind of go in and feel a bit more comfortable with. But coming into Oregon, that's not always the case. So it took me a while to settle down and find a provider. Once I found one, I had so far pretty easy interactions with the provider. I thought they charged a lot because every conversation required a $25 copay, which if you're not financially advantageous could really prohibit you from getting the care you seek. And so as a part of that process, the provider gave me a medication. When I took that medication, I noticed I had a really funky response to it. So I immediately reached out to the team to say, hey, I'm not sure what this is, could be a reaction, but I kind of wanted to talk to someone about it. And the response I got back from the provider was, oh, it's just anxiety. And I was shocked because I thought, yeah, I am anxious. I'm taking a medication. It is making me feel bad. I'm going to be a little anxious about it because I don't know how it's hurting me. And so that provider's response didn't take into account my safety, didn't take into account anything else that might have been happening. And so I knew to contact that provider and say, hey, this is a big deal, right? If this medication could have caused my death, it had been blown off as, oh, you're just anxious, get over it, continue taking the medication. They didn't tell me to do something safe. Hey, if it's made you feel this way, don't take it anymore and go to the hospital if you feel, like you're short of breath, which is what I told them. Hey, I'm kind of short of breath. I'm feeling this way. And that caused me to say, hey, let's escalate this. I reached out to them, asked them to have the doctor notify me because of the reaction, and then asked to have their office administrative team contact me. Because in my opinion, if it was my mom, she wouldn't have known to call. She wouldn't have known to stop taking the medication. She would have continued, and that could have resulted in a loss of her life or a severe reaction or ailment. So I was able to speak with that team. We were able to give that provider some communication. And then I also talked about it from the Black experience of having my experience in healthcare be ignored, having my experience in healthcare, where I, through no fault of my own, listening to my providers, did what I thought was right and didn't have a positive interaction. And so that led to them kind of doing some education with the provider. And that's how I was able to advocate for myself. And information that I would share with others is please take the time to follow back up with your medical team if anything they have done has made you feel uncomfortable. It doesn't have to be as significant as my medication issue. It could be they called you the wrong gender, or maybe you have a name, right, that is of your culture, that is normal, right, within our wheelhouse, and they mispronounce it wrong. Follow up. All those things are about self-care and they matter.
Thank you. Some excellent points to bring up, particularly since you highlighted not only, the Black experience, because many of us became healthcare professionals through experiencing discrimination in the system. And even given that knowledge and advantage, we still face disparate treatment as professionals, but also as patients within the system. Kyle, tell us something about your experience choosing a healthcare provider, a story you have to share, what went well, what didn't go well, an example of when self-advocacy using your own power works and worked to bring about a better outcome. And what have you tried and what worked?
Well, good morning, everyone. I'm Kyle Rodriguez-Hudson, Executive Director of Transponder, he, him pronouns. Like Lenora, I am a transplant. I arrived here from Chicago about 7 years ago. And as a healthcare provider myself and coming from a big city, I'm used to having quick access, picking up a phone call, making an appointment. getting my medications, things of that nature. When I moved here, it became a little bit difficult because not only, as a POC person, I'm also a transhuman. And so that required medications and connecting folks. And when I began my transition here in Oregon, I realized that I could not get access as quickly as I could. And I was automatically directed to Portland. And we talked about, copays. Lenora talked about copays. Well, there's costs. Portland is not down the street. It's 2 hours from here. There's gas involved. There's transportation issues. What if your insurance is now considered out of network because you cannot find a provider in network? So all the costs continue to go up. I remember talking to providers, and they wanted literally, essentially re-traumatizing some of the struggles I was dealing with, because they needed these documentations. And as a mental health provider, getting a letter from a therapist I had 3 years ago from a different state to see whether or not I was in sound mind and body to take a medication or begin my own medical transition. And so it was a lot of conflict within myself and trying to understand that I'm a provider, you're a provider, you should understand that I'm human before anything else. And so that's the part that was very, very difficult. And, out of all that struggle, I was able to connect with a nurse practitioner who happened to be working at the healthcare department that I was at, who was from Illinois, who understood my struggles. And fortunately, I was able to not have to go through so much red tape. And so it was just by knowing someone who understood and then ask me invasive questions or made me question my sanity or my function, because I wanted to make sure that I was of sound mind. And so a lot of it is about access and knowing people and having a privilege. And I think oftentimes POC folks, we don't have a privilege, but we do. We all have a privilege. And when we have access to resources, have access to people who can guide us into the right direction, that makes our, existence a little bit better, especially when it comes down to healthcare. And so it's like, if I saw a provider who looked like me first, I would be more comfortable simply by that own existence, regardless of all the other intersectionalities that I may hold. And so that's the other piece of coming to a place that doesn't necessarily have a population of people who look like me, and trying to see, am I safe in that environment? So advocating is looking at all the boxes and seeing where you feel safe. It's not about the signage you put up to say, hey, we're welcoming. It's about the actual feeling that that patient or that client comes to you. And if they don't feel safe, it's not it's not a them issue. It's just the situation, right? And so I think it's important to really obviously know your exits, know where you can go to feel safe, and then kind of come back and address the situation.
I guess I could be considered a transplant, albeit from 40 years ago. And growing up in a family of Black professionals whose family and friends, extended family, was Black professionals, and then moving to Oregon, a state which officially banned Black people, practiced all kinds of discrimination as if it were a southern state in the Northwest. So my experience was also, I was considered an anomaly because I would often be the first person of color, professional person of color, encountering patients and clients and having to address that directly, as well as being a patient, and often being the person who they were taken aback that I could actually speak in medicalese with a California newscaster English accent, and walking in and getting that look. Oh, we didn't think you were one. So that level of discrimination. Have you encountered that? Lenora first.
I have, and it's a very interesting thing. So as far as being like African-American, a lot goes into your name. So I happen to have a fairly race neutral name of Lenora Johnson. So when I get there and somebody looks at me or, calls my name in the lobby, they're not quite sure what to expect. And so I've had that experience where I walk up and they think I'm something else, and I get asked questions twice, or my insurance is verified more than once. Those sorts of experiences happen in the system all the time. I have had experiences where providers, right, don't listen to what actually is happening, but they want to talk about something else. Oh, so you came in because you've had chronic headaches. Well, have you thought about doing this for weight? Or have you thought about doing this for something else, right? My issue became whatever their agenda was, and not necessarily, the experience of my own. And in those situations, right, how do I feel? Kyle kind of spoke to safety. I don't feel safe. If I came to talk to you about my blood pressure and you all of a sudden are like, oh, you need to go on a diet. How often are you walking? How often are you doing this? Doesn't make me feel heard or safe in those environments, right? And so in my exploration of looking for better quality care and providers who can sound and think like me, or who can at least talk to me like a person, right? That's kind of the process I look at. And if they don't do that within that first session, I kind of get out the gate. That might have been my segue into other things. So I apologize if it's not the full answer to what you're kind of saying, but that's the emotion and thought that totally came up for me with your question is, we need to make space for people. Even the idea of let's pause for our Spanish interpretation. Let's pause when we're with our provider. It's not a rush. You don't have to get it all out, and you don't have to get it all right. It's their job to get you there, to get you what you need, to help you understand what's going on with you. And if that's not the option that they're giving you, that's when we want to evaluate if that's the right person for us. So kind of letting yourself know if it doesn't feel right, stop. And that's just my little thought about that. So thank you.
Kyle.
Oh, I think it invoked a lot of feelings of being othered. I think that was of not feeling safe. And it brought me up to a situation where as a trans-identified person, going for an annual, going to a gynecologist, right? And my name is very neutral, it says Kyle on it. And going into the waiting room, and the individual called a name and said, looked at it and said, Kylie. And I tried to figure out, well, I ignored the person because that's not my name, and kept saying it again. And then I said, wake up, hold on. I think she's talking to you. And I said, do you mean Kyle? It's like, oh, I thought it was a misprint. Why was that? And, and so like educating in that moment, there was a lot of misses, a lot of like, well, I don't understand. I'm like, but you do provide services for trans folks. And you decided to change a name because it was a male name, and males shouldn't supposedly go to see a medical provider of that such nature. And so it's very difficult as clinicians or any profession. We go through these series of educations. We go through the DSM, that becomes our own Bible, right? You go to medical school, we focus on that. You become an electrician, you focus on that. But it's the real world that helps us and builds us. And that was a teaching moment, which I'm always telling everyone, every day is a teaching moment. But having that provider glitch, they were focusing on their well-being and their more comfortable zone instead of the other way around. And so I think that's the part of being othered, when you're just trying to go to the doctor and having to explain your existence before you actually get treated for what you're going there for. So.
Great. Given that we often have a right to choose our own healthcare provider, what would you like people to know about how to exercise that right?
So I would say use Google. And I know we have to be conscious of what we Google, but there are folks that take the time to write medical reviews of doctors. See if there's any out there. See if they have a unique kindness. Look at their practice online, right? If they're a part of a group, let's say if it's a doctor, are they board certified? Do they have language that you can connect with? Do they have an independent website? Do they support your needs? So I'm a therapist. I joined WPATH. I do things with gender affirming care. It's very important to me to keep that education out there, but I know having that WPATH badge will also allow other people who need that support to know that I'm safe. Written into the first thing is I'm an ally. I want equality. I want people to be treated fairly. It's so important. It's in the first line of what I do. I
Can
am
you
African American.
explain WPATH?
Yep. So WPATH is, and that's the acronym. So in the event you need gender affirming support or education or searching for a provider, that organization was created to help advocate on folks' behalf, right? To help give you the knowledge that if you do need a specific treatment, if you need top surgery. So if this is in your wheelhouse of kind of knowledge, if you need any kind of surgical changes to make you feel like the person you are, they didn't have an avenue because the bias, as Kyle is speaking of, is in the community. Providers had their own agenda. So if you identify and you have he, him pronouns, and you go to a doctor and they refuse to say he, him, and you're she, and every time you come in, they also won't use your identified name. They only want to refer to you. I'm sorry, I know that's what you call yourself now, but what's your actual name, right? That kind of language being present. My best friend, her name is Emaniqua. It's a whole mouthful, but because people don't respect even trying to ask for it, she just puts Nika on everything she writes, right? And so in these windows, in these spaces, in these places where you don't have a provider and you don't know what they are, you don't know how they kind of talk to folks, right? Your provider could have a religious background that you aren't aware of and won't write prescriptions for any pain medication. You may not know that until the end of your session. And you go to ask for your medication and they say, oh, I don't believe in it. I'm not going to write you a prescription for it. But what if you don't have $25 to go to the next provider? So also calling and asking questions. Is this provider open to all forms of treatment? Are you guys allies of members of my community? Do you have a person of color on your staff or someone representative of my community? And it makes me think of a recent video I saw, and there was a white provider and she was talking to a Black nurse, and she said, you know, I had to put in a psychiatric consult for one of the patients on the maternity floor. And they said, well, why? What happened? And she said the lady kept punching herself in the head. And so the Black nurse said, I'm sorry, what? She's punching herself in the head? You put in a psych consult? And so the nurse happened to say, is she Black? And the white provider said, yes. And she said, was she doing this? And the nurse said, yeah. And she said, oh, she probably has a hair weave. And for people of color, when you can't get into these little crevices like my cornrows here, the easiest thing to do is pat it, and that'll help relieve the itching. But instead of anybody asking that person a question, they put in a psychiatric consult, say this person's insane, something's wrong with them, they need help. When if we ask the question of, hey, is everything okay? Could it change the door? Ask questions. Don't be afraid to put your provider on the hot spot. That's actually your job. Can you meet my needs? Can you see where I am? Make sure they're an ally for your healthcare. So that's what I would kind of say. Research, ask, and be prepared to walk away, that provider may not be the one for you. Don't force it if it doesn't feel right.
Kyle, same question, given that we have the right to choose our own healthcare provider to the degree that we have a choice, if we have a choice, what would you like people to know about how to exercise that right?
Well, I agree with Lenora. Ask questions, do your research. Say going to within our community or the trans community, we literally try to seek out providers. And then if something goes wrong, we communicate that to our other community members, right? So like this person, horrible experience, or this person, great experience, to make sure that we feel safe. And so do the research. And if you don't have access to like the internet or anything like that, word of mouth can go a long way, right? And so that's really, really important. I think the other piece is oftentimes you do choose a provider and you do connect and you feel comfortable. Then it comes to your actual EHR and you log in and you see female or you identify as male. I had a community member reach out to me devastated that when they opened up their file, it literally said transvestite. And how triggering that was for this human who was going to this provider and then opening up their chart and using outdated language. And then when went to that said provider, oh, we've been working on it, right? And so it's like, how long have you been working on something that is triggering, that's completely outdated? And, when Lenora talked about, being part of WPATH and it being an ally, you don't have to be a trans identified human to be part of WPATH to even get education. And it's important for people to say, continue the education. In grad school, you do a culturally competent course and it says, oh, now you're good. No, that doesn't work that way. It's every single day, every person you interact, any environment that you're in. And it's important to just ask the questions and feel safe. And even though you may build a rapport, there may be more systems things that comes around, like a chart and using inappropriate language or traumatizing language. And then taking that feedback as a provider when you may do right, but your organization you work for is actually causing more trauma. And so, we need to be accountable for what we do as providers, what we give out, and as people who come in and see folks. So really important to just be vulnerable and accept that feedback.
I think we've reached that point we talked about in our meeting yesterday where we're now beyond Tabasco. So, and this is off the script, but it's related to what we've been talking about. At what point do you feel comfortable talking with your provider about systemic discrimination, intersectional discrimination, and how do you bring that up?
I think I do it pretty quickly, especially here in Oregon, because I'm Black everywhere I go. There really isn't, I can't pretend. There's no changing of the guards of the skin tone. And so for me, I always point out, I need you to pay attention to me because the likelihood of me dying in the system is greater than other people.
The data shows that.
Absolutely. So, and part of my work, especially in pregnant mental health, Black pregnant mental health, and even physical health, we like to talk about things. Several things have come up. If you knew anybody taking lisinopril, medications are not tested on people of color. Most often, it is white males, right, with their fancy age of 35 to 50, which means if you're not in that wheelhouse, the healthcare system isn't quite sure what these drugs will do to you. So what did we find in people of color? After taking lisinopril for several years, they would have these swell ups, tongue swollen, face swollen, eye swollen, right? Some of them imminent death without knowing this medication had that outcome. If you are a person of color, recently they've shown that the pulse ox machine, and if you don't know what that is, you go to the doctor, they take this little duct clamp, put it on a finger, and it says how much oxygen is in your blood, right? They're kind of seeing. That's a test that goes through the color of your skin to determine how much oxygen, right, is in there. So if you are darker complected, that test, that little clamp on your finger, which tells people you're doing well, can be inaccurate. So if that provider is using the instruments and not looking at you, they could think you're healthier than what you actually are. We want to make sure people hear your voice. We want to make sure you're seen. So I say, hey, Serena Williams is a millionaire and was at one of the most prestigious hospitals in LA. And the white providers around her, and this is all recorded on her HBO documentary, was like, oh, you don't seem like you're distressed. Meanwhile, she has deadly blood clots that have gone into her lungs that are literally suffocating her. And if it wasn't for her advocacy, and I've had these before, I know what this feels like, this is happening to me, she would have died. Black healthcare does not look at your socioeconomic status. We have the same outcomes if we are low income or no income that our millionaire counterparts have. So it's not financial, it's this. And if we aren't using our voices to say, hey, even if you look at your lab results, there's a kidney test for people who are not Black, and then you see the other one for what it is if you are of color, right? They separate that right in your medical reports. Be conscious of it. Talk about what matters to you. Being Black is a part of our health condition because racism is a public health condition. It is a public health problem that will eliminate our ability to really get good care. So be Black in there. Make them uncomfortable. Listen, I need to know, how do you help Black people with this issue? I have a culture that lived through trauma. We naturally have higher blood pressure, systemic high blood pressure, because of the stress passed along from our ancestors. How do you treat high blood pressure in these individuals? Right? Am I going to get, you should be 110 over 70? Am I going to get, I can be 120 over 70? How do we talk about my family history? So make sure those things are important. If you fill out that little chart and you have a family history of diabetes and your doctor doesn't talk about it, talk about it. So that's kind of what I would say. Be proactive. Be Black first. Be a person first, right? I am showing up as this person. Be that and make it their issue to research. Well, if you don't know how it affects Black people, can you look that up and then can we talk about it? Make it be there. Make them figure it out and then be open to say, I'm going to educate you. This is how it is in my community. Let's see what we can do better together. I do it, all the time. I had never had experience with a trans Muslim person. So I had to take a training on it because I was like, how does it work in that community? How do I help you be safe, right? If you are a practicing member of your religion, how do we make you safe and you in all your spaces? So I want to be uncomfortable. Bring it to me as a provider. I love it. Force me to know more. So do that for the people you see. Force them to know more.
Kyle, you're up.
The first thing I was thinking of how with Black folks in our language, we have to, it's job interview and it's hood, right? The world that sees it. And I say that simply because we're also programmed to not show out, because if we do, we're the aggressor. So if we're advocating and saying, hey, I don't feel right, I'm not getting aggressive. I'm not becoming an angry Black woman or angry Black man. I am telling you, I'm feeling X, Y, Z. And so I think oftentimes POC folks don't go to providers because they may not be believed, right? And then when something pops off, if you will, in certain languages, and you become reactive, then, oh, you're the aggressor. Why do we need to elevate our voices to try to be heard, but not actually be heard? Because of your illness and your symptoms, that's not where I'm more about your temper. And so trying to find a way to show up in a way that our white counterparts will hear us and then try to articulate in the way of all these symptoms, and it's really difficult to do that in a state that is predominantly white, Also, depending on certain counties, I think I said something about this elevated wokeness, but it's also there's underlining
That
racism.
is Wayne County, Eugene.
And there's these implicit biases or these unconscious biases that are not talked about because they are woke. But it doesn't change the fact that there is this unspoken kind of like gaslighting behavior, right? Another thing that came up was when you feel like you're going crazy, like you see there's a blue sky, but why is everyone not seeing it? That is a micro and a macro aggression, right? And people who do not look like us, and mainly our skin color, focus on that, may not understand that experience. Or even more so, if you go to a Black provider, it looks like you, but you are a trans person, they may not automatically also disagree with you and not give you the right treatment. So it's all we have to also consider, because we look alike doesn't mean we are alike, right? And so I think it's important too to really understand your environment, because it's every day. It's like waking up. I think Kendrick Lamar has a quote where he says, your one protest, my 365. And so constantly, like you wake up Black, regardless of your intersectionalities, and you go out there and you try to get healthcare, you try to provide healthcare as a Black provider, right? It's this ongoing circle of like, no matter how many protests you do, I still wake up and I'm an underrepresented community and I have to fight twice as hard. So especially for my healthcare. So I think it's like, be uncomfortable, because I'm uncomfortable that I have to have this conversation with you.
I'd like to bring in Dr. Reveles for her presentation to carry on for where we left off. But just to say, when we bring up our diagnostic criteria for whether racism exists, understanding that there is a science that not only that we replicate from experience, but that as professionals, there's at least an 80-year, nearly a century history of healthcare professionals coming up with terms like microaggressions and understanding, okay, there are these signs and symptoms that are in the system. It is not our opinion, it is fact. So when Dr. Chet Pierce comes up with studying extreme environments like Antarctica, or people's response to being a female test pilot in a male military, or a female astronaut in a male military, and then making the extension, being Black in America is like being in Antarctica. You're dealing with an extreme environment that's been normalized for some, but discriminatory towards us. Allie, you're up.
Thank you so much. Good morning, everyone. I'm Dr. Allie Reveles, although you can just call me Allie. I'm a licensed psychologist, have been licensed for about 1.5 years, but practicing for 8 since my training began. I sort of just want to piggyback on what our panelists have already discussed, starting with you having rights as a patient or a healthcare consumer. I think it was not until I attended therapy myself while I was in college that I first had that told to me, that I had rights as a patient, as a therapy client. And I would love to read for you. I'm sorry I don't have these for you. The rights of patients that comes from the American Medical Association. So the first 2 rights that you have are to courtesy, respect, dignity, and timely responsive attention to your needs. This is a right that if your provider is in the American Medical Association, they have agreed to give you, right? Your second right is to receive information from your physicians and to have the opportunity to discuss the benefits, risks, and costs of appropriate treatment alternatives, including the risks, benefits, and costs of foregoing treatment, right? So not all physicians are going to be a part of the American Medical Association. I happen to be a part of the American Psychological Association as part of my professional community. And with that, I have agreed to abide by the APA's ethical standards, right? There are certain things that I've agreed to do as a professional in this community. And if I don't follow that, I could be kicked out. I may not lose my license. That is a state regulating board decision, but I may be told by the association, hey, you're not upholding what we want you to uphold. We no longer want you to be a member. And I think going to something Lenora said earlier about asking questions about, you know, is your provider part of WPATH? Asking what professional associations they're a part of. And I just did a quick Google search to find all of those patient rights. But being able to look into those associations, what ideals do they uphold? What can you expect as a patient of somebody part of that professional organization? How can you expect to be treated? I think one of my favorite rights to make sure my clients know that they have, even with me as their therapist, is the right to privacy, right? And that goes for physicians too. They don't need to know everything about your life. There are some things that I'm sure you want to keep private, even from your therapist. I let my clients know that that is totally fine and well within their rights. So I think, yeah, going to professional organizations, knowing how people sort of see themselves as professionals, knowing what those groups are that they are a part of. I also share my treatment approach with clients in our first session. I also like to offer a consultation even before that first session, because the intake, I always joke, is a little bit like an interrogation, right? I'm learning about my clients, about their history, what issue is bringing them in, what do they think about this issue. But that's a lot to share with a person that you've only met one time, right? That this is your first time meeting them and you have to tell your whole life story. So I like to offer, and many therapists, psychotherapists offer sort of a 15-minute phone consultation so you can chat about what you're hoping to get from that appointment. I think too, Lenora and Kyle touched on this with calling ahead of time, right? And asking these questions of staff in a front office. Knowing what you're going in for. So I was a transplant in Oregon. I am now actually back living in Northern Illinois. So with my recent move, I've had to find new providers myself. Started with my OB-GYN, you know, the reproductive health stuff, and knowing that I want a provider who is going to respect my bodily autonomy. Right? Especially certain things happening in the world as of late, certain Supreme Court rulings. I want to make sure that I'm respected as my own person, and that if I need a medical procedure done, my physician is not going to stop because of my age, because of my marital status, right? That they're going to listen to me no matter what. I found my new provider actually through a TikTok video of all things, and a provider list that creator had made. They were an OB-GYN themselves, but I knew that that was something I wanted, right? I think, again, Lenora spoke to this earlier, but as I'm looking for a primary care provider, I want to find somebody who either understands health at every size or is not going to pinpoint my weight, because I'm a fat person, and I say that lovingly about myself, but it's not going to pinpoint my weight as the source of every problem I bring to them, right? And I've experienced that too in certain provider situations. They want to check my A1C levels, which were recently checked, and you get nervous, right? Like, oh, well, maybe I am having this issue because of my weight. Maybe this is something I could have done something about. And then my lab work came back fine. And I was like, oh, okay, this is not me. This is a bias that my provider might have, and really thinking about how I don't want to encounter that bias in the future. So as I'm going through this, I'm trying to stick to my points, But really, again, like thinking about those professional communities that people are a part of, being prepared with those questions too, and asking, what professional communities do you belong to? What trainings do you engage in? And this, again, Lenora spoke to this too. As a licensed psychologist, we're responsible for maintaining continuing education and making sure that we ourselves are educated. So what are those issues that your providers are being educated about? Are they engaging cultural competence training to work with specific groups that you're a part of? Whether it be a racial group, an ethnic group, a religious group maybe, right? There are certain religions that have different beliefs and standards about what medical procedures they want to allow happening to their body. Again, going back to that respect of bodily autonomy, is your physician going to respect that you can't get blood transfusions because of your religious beliefs? Or would they violate that? Hopefully they wouldn't. That would be a very big no-no. They would definitely lose their license. But, right, these are questions that we want to be asking and making sure that our beliefs are being held high because they are precious, right? They're precious to us and deserve to be respected. I also really love to remind my clients that they are the experts on themselves, right? I may be the expert in psychology. I may have gotten a PhD and gotten this formal training, but I don't know what it's like to live as my clients, right? I like to envision myself as the passenger with the map and my client is driving the car, right? They have the information that I might need to help guide them, but they're the ones who know themselves best, right? You are the one who knows your body best. You know when something is off and you're not feeling right. You want to make sure that you have a provider who's going to listen to you about that and use their expertise to help you figure out what's going on. Rather than telling you, no, actually, you're feeling anxious. You're not having a response to a new medication you're taking. Not a great approach, right? Lenora knew that there was something going on that wasn't right. It wasn't her normal. It wasn't the baseline, and wanted to reach out and get support in that. Thinking about the medical healthcare system, similar to the mental health care system, you know, charting is a big deal. Our medical records hold a lot of power. Courts can request our medical records, right? If that is pertinent to whatever court case is going on. There are a lot of positive and negative repercussions to that. So I also encourage clients, you know, let me know if there's something that we talk about. And as a psychotherapist, I take great care in making sure the notes that I write for each session have enough information for me to be reminded what's going on, and for the insurance company to say, okay, this is the treatment, we will pay for it, but not super detailed information, right? I never include other people's names. I may not even speak to issues like directly and specifically if I don't think it's information other people need to know. Similarly, you can ask your physician to document certain information in your chart. If they suggest a treatment and you're asking questions about it, you're not comfortable with it, you found a different treatment online, you want to talk about that, it's okay to say, I would like you to include in my chart that I presented this option for treatment and you said no, right? And they need to document that, and then it's in writing. And as my elder mentor, Mark Harris, would say, also make sure they're not saying that you're non-compliant, right? Or that they're saying you're non-compliant. You can ask, you know, to make sure I'm bringing these issues to you because I have questions about this procedure. Please don't say that my denial is me being non-compliant, right? I think I also heard an example from a colleague about a medication issue. Somebody was not able to access their medication. I believe it was blood pressure medication. For some reason, their prescription hadn't been filled. When they went into their physician and they were asked about how regularly they were taking it, they said, well, no, I'm not taking it regularly. I don't have access to it. In the note was charted medication noncompliance, right? Which would probably be interpreted by other medical professionals as this person just doesn't want to take their meds, They're just refusing to do it. Rather than the issue being this person doesn't have access to their medication and they can't take it as prescribed, right? And there was a new federal law. It came out, and Mark, I don't know if you know it, you might be able to help me. I think it happened last year, making access to your medical notes, your medical charting, much easier. It was too hard for people to access that information. So any provider you go see, including mental health providers, should have a way for you to access your charts and request even therapy session notes if you so choose, so that you can see what is being documented about you. I encourage you to look into that and bring those to your next appointment and say, hey, I noticed this line in my note from our last meeting. What did you mean by that? You know, here's what I remember from that meeting. Why was it interpreted in this way? But that information, again, holds a lot of power, right? There are certain diagnoses in the mental health world that I have long conversations with my clients about before I include them in the chart, based on, unfortunately, stigma that still exists and a worry that they might be denied different services in the future because of those diagnoses. So I think those were the big points I wanted to hit. But really remember, you are the expert on you. You are going to a medical or a mental health provider for their expertise to help you. You can fire them, which is sort of powerful. I don't know if you've ever been able to fire a provider. I have yet to do this. But if they're not meeting your needs, if you're not getting good care, you do not have to keep seeing them. I usually tell my folks, let's try at least 3 sessions. If we feel like we're not a good fit, I will help you find somebody else, because you deserve to feel safe, comfortable, heard with any provider that you go see. Okay, Mark, I'm going to hand it back to you.
Thank you, Allie. I think that it might have been an addition to HIPAA, because certainly the providers that I'm using basically give you, let's see, in New Mexico right now, it's my chart. So you can access your records and ask for an explanation. Hopefully, they don't charge you extra for that explanation, because they've done that too, but certainly prior to the new law change. One of the challenges, and I can take the privilege of doing this because it's sponsored by the NAACP, but as a Black psychologist, racism exists. It doesn't exist in DSM, that is the Diagnostic and Statistical Manual by the American Psychological Association, though Black providers have been trying since the early 60s to have that included in APA, and basically have diagnoses and, you know, racial self-hatred, et cetera, et cetera, et cetera. But, you know, as I've talked about within the, that there is a science, mostly it's people of color and allies of people of color who've kind of documented this systemic discrimination, even though there are some people that don't think that exists. But as Lenora talked about and Kyle talked about as well, not only is the technology not race neutral or taking race into account, the training still uses mythology where they think, oh, Black people have a higher tolerance for pain or have thicker skin, or a lot of mythology that doctors and providers are still getting trained with. And so anytime you bring up and use the diagnostic criteria for racism, saying, this is happening, this is happening, this is happening, you are still considered paranoid for bringing it up. So you actually have to develop a trusting relationship and they do a bit of not only education, but also be able to talk about the science, the data, not just my opinion, but the science, the data, the diagnostic criteria that says, this systemic discrimination exists. Here's what we do about it. And you might have to do that yourself in terms of self-care. We can probably engage for the last 20 minutes in Q&A. You can put your questions into the chat or even use the function of raising your hand. I can't monitor that.
While we're waiting to see if someone has a question, this popped into my mind as I'm thinking about our Spanish-speaking folks attending the training. Ask your doctor if they have language translation services available for you. Do not feel forced to have your children try to translate complex medical information. Your providers are required to offer options to you. So please take the time, ask for things written in your native language to be sent to you as well. So if reading English is not it, ask for Spanish, ask for support. Don't be afraid. And I would say kind of ask for anything in our language, regardless to what our needs are. So that's something that if it needs to be in Braille, if it's hearing impaired, look for TTY, TDD support services. So those are visual hearing impairment support. Ask for what you need. That's my little thing I wanted to throw out there.
Good call out. Can I ask you a personal question, you panel members and Allie? What is your cultural self-care regimen? What do you do to take care of yourself?
I'll go first. One, typically, I see my own therapist. I am a therapist in therapy. You know, I hold my patient's privacy very highly. I do not like to talk about the things that are tough that I carry with me. I can't talk about that with the loved ones in my life, right? I need another professional who's also going to hold that privacy and space. And when I talk about those issues, I never talk about client names, just the issues that are coming up that are challenging. So I have my own therapy. And I would say too, my move back home, this was self-care for me. I think one of my colleagues in these NAACP committees commented on how much happier I look. But I feel that in my soul, right? Being closer to family, living with family again, that is good self-care for me. And I know, and this is included in my ethical code from the American Psychological Association, I'm required to engage self-care, because if I don't, I can't hold space for my clients and I can't put their needs first. So it actually is a requirement for me to engage self-care. So I did that in a big way by moving home. I do that in small ways every day by having a designated space where I do therapy, where I can sort of ground myself and, center myself for my clients. I engage a mindfulness practice and taking care of my own physical and mental health.
Kyle?
Okay.
Or Lenora, either way.
Lenora, you can go.
But you're already off mute.
As soon as okay, fine. No. So Also, a therapist in therapy. I always tell people, do not believe your therapist if they say they've never done therapy. Because so I would say back out and go look for another therapist. The other piece is your environment is key. I have my home office, and when I leave, I close this door. And when telehealth, I tell the folks I see, leave me wherever you left, like wherever I was session with that you had me in, leave me there, because you don't want to sit in that space, because your environment is a big key. And I'm a person who sometimes likes to pick up and go. And so when I pick up and go, I literally say, I'm going to go to Seattle. I get out of Eugene. I get out. I know I got to come back, but I get out. And I think oftentimes we become stuck in this bubble of work, and we don't take pauses. And one of the things that I enjoy is music and listening to music. And my music reflects my mood. And so after every session, after every meeting, I do a little shimmy to Aretha Franklin, Until You Come Back to Me. 2 minutes, a little dance out, and then get back to it, because I feel a little bit better. It doesn't heal the stress, but it definitely makes it a little bit more better to be managed. And so just finding some physical activity, a good song, a poem, go outside for a minute, go to the mailbox, really trying to keep yourself and not be stuck in this Zoom world and these home offices worlds, do something else.
Excellent.
Absolutely. So my self-care routine, I build it in pretty much on a daily basis. For me, self-care is like food. It is a building block to keeping me functioning. So if it's when I work out in the morning, I do stretching. I do a thing called habit stacking. So when I'm brushing my teeth, I'm doing squats. Like, that makes me happy. It's strange, but it's one of those things where I know I like to get the most out of my time. So that might be something. I listen to my Spanish lesson while I brush my teeth. I kind of integrate those things in. And I always make time for me to do something that matters to me each day. And so I tell people, I don't believe in having a to-do list of more than 3 things, because that gives you an immediate win. And I feel successful if I got one thing on that to-do list, but if I hit all 3, it's new money for me. So I'm like celebrating. So I like to keep what I need to do very short. That allows me to have my wins each day. And then big time, I'm a hardcore concert goer and traveler. So when the pandemic hit, I literally thought I was like evaporated into dust because there was no music and shows. So now that it's back, I'm back in the swing of things. I'm going to see like Hamilton, I think, for like the 2nd or 3rd time. I've seen it in Portland. I've seen it in Eugene. I'm going to see it in Eugene in a few months. So I try to make those things happen for me. And that's just some of the things I like to do. And even if it's, hey, call your dad, or hey, send a text message. For me, that's also a part of my self-care, which is extending the love I have for myself to others. And so you guys kind of hit the nail on the head. Your therapist does have a therapist, but that's kind of the culture we create in our business. So I know as a social worker, I had to get 2,000 hours of clinical support for my independent license. And that's just you going to a therapist to talk about stressful things that come up. So we literally breed it into that environment. And I will say, talking to someone is great. I know we see these really cool memes that are like, my dog's my therapist. Your dog is not your therapist. Your dog is a support person for you. Agreed. But what you get from talking to a human and someone who can understand, relate back your emotion, help you validate yourself, it is a powerful tool. So even if you can get in there once a month, once a quarter, once a year, I always tell someone, find time to talk to somebody about the icky stuff, because there's just some things in life you aren't going to tell someone you love. And you don't have to tell them that, because it might come up in your face later. So to someone that can never bring up your history to anybody else you know. So that's my other little bit of self-care.
I see a hand up. I see you. You have to, yeah.
Can you hear me?
Yes.
Oh, excellent. Well, from what I took from all the conversations that I've been hearing from the experts, I was just wondering 2 things. I've been moving around, with different doctors. I actually ran out of one clinic because I couldn't move to another doctor or change doctors because they have no more doctors that I can choose from in that clinic. So I had to move to a different clinic. Recently, I only have one consultation with that doctor, but I really don't know who she is. So from all the conversations that you had, seems to be that it's a good thing to get to know the doctor to see if it's a good match for you. My question is, should you make a consultation or your second or first consultation just to talk about what she believes, what organization she belongs to? Because normally they're always rushing, They have at least about half an hour to see you, prescribe, see what your problem is, and then you're at the door. Do you make an effort just to make one consultation so you can talk about these questions and get to know more the doctor and see where she or he comes from? And the other question I have is, let me see here. One of the reasons that I've been actually trying to move from doctor to doctor is because either they don't know you that well, or they don't make the effort to see, how you feel about their prescriptions, the consultation, or also they don't make a good research before they see you, like to keep you healthy. For example, sometimes you go see them and they just expect you to tell them what's the problem, but they don't tell you like, well, it's time for a physical, for example. So like they know, where you are, what things you need. It's more like they act on reaction, not as prevention. They don't know very much about what you really need as a patient. And that's one of the reasons that sometimes you get disheartened because they don't give you they see you as a number, number next, number two, next, number three. It's not like Gustavo. Oh, glad to see you. I know who you are. Last time we talked about this, how you doing in that area? Okay, what is your issue today? That kind of conversation will make me feel like, they really know me, they're working with me, and they're trying to get me really healthy. So that's my take on the meeting today. I hope I can help with the answers that you provide to these questions that I have. Thank you.
Thank you for those questions. They were really great. I think what I would say to your first question is, I don't know that it's necessary to make another consultation appointment with that provider to find out that information. Often it will be on a website. If you have computer access or are able to get to the library with computer access, looking up that provider in their current location, typically there's a little bio that will include where they were educated, professional organizations they're a part of, their national provider identification number, or I would suggest calling their front office and asking those questions of the staff. And if they can't give them to you immediately, asking for them to follow up in an email or a MyChart message with that information.
Okay, thank you.
I also think that anything you can do to make yourself more of a person and more visible to them as a person and less a number, you should do that too. So even if that takes another meeting, like they'll schedule that to find out, what research they've done beyond their training to find out about particular patient problems and how that relates to you, so that you become more of a person to them, like a concerned for my health patient. They really like that, and it puts them in the position of being more of a helper and you less than a number. So anything you can do to make yourself more human and relatable to that person always goes to your benefit. especially when you're starting to talk about difficult subjects. They're not expecting Mark Harris to look like me. They're not, right? So when I walk into my eye doctor, because I have diabetes, parents had diabetes, so, glaucoma. So when my provider talks about glaucoma in African Americans without any prompting, that goes a lot towards trust. When a white provider starts talking about systemic discrimination, like for example, when we talked about in our meeting and also here, we give extra trust to providers of color. Most of us don't have that option. So if my white provider brings up systemic discrimination or talks about a healthcare concern particular to African Americans without prompting, love that.
I would
Thank you.
also suggest that, yes, we can read bios, we can get feedback from our community, but I'm a fan of nonverbals. I always say I can't control what my face says. And so no matter what that interaction that you read or you hear from someone, being in that room with that provider, and yes, they have, we're providers, so we know we have a time limit, we can see people, but knowing that there is some reflection, right? There is truly a positive feel when you're in that space with that human being. Yes, you may be dealing with some physical things, maybe some mental things, but having that provider come to you and truly feel it in their body language, leaning into the conversation, truly, or just looking at you, not looking away from you writing notes, but looking at you. And so I think that's the bigger piece as well, is you can do all the research, but it's that one interaction could really make a difference in your relationship.
Thank you.
And I just put in the chat, take your time. If that provider is rushing, call it out. This is important for me. I need time to make sure I understand. If they pack that schedule where they only give themselves 10 minutes to see somebody, that's their problem. And everybody who's had a late doctor's appointment complain. You've been sitting there, you're like, why am I sitting here 40 minutes in this room and nobody helped me? You call my name, I sit back here, right? We also want to make sure our providers are accountable. And if it was something that you're worried about from a previous appointment, hey, you didn't ask me what happened when I took this medication. Hey, you didn't ask if I felt better. Let me know. Like, I want to talk about this. Or it freaked me out when you told me to take a medication. I saw the side effects and I didn't want to take it, right? Take your time in that space. That's one of the most valuable things I can say. That's how they know, oh, this person is invested in how they feel, right? Because they don't, sometimes medicine in our system are more reactive than proactive. So they want you to get sick before they stop you from getting there. So take that time and hold your provider accountable to helping you learn more about yourself and care.
Thank you.
There is also a word for it in Spanish. I was talking with one of my friends who's that we've known each other for 20 years. We're both in the substance use disorder field. Jose, what can I do to build more confianza? He said, I don't know how to answer that exactly, because you and I go back a long time. That's part of it. I go, well, yes, but we've talked about with dealing with certain populations, you don't have a 15-minute hour. You make your impression in 30 seconds. And what sells you on me in that 30 seconds? So you don't have to answer that. And he didn't have an answer. And I said, just think about it, because we need to be able to talk about that. What's that culturally specific confidence, confianza building, which it isn't, it's an unshakable faith. And that's the nearest English translation I can give without, being a native speaker, but absorbing that. But it is a quality.
Yes, thank you.
Any final thoughts in our last 3 minutes?
I do want to just make sure, I did respond, a couple of us, to Marianne in the chat, just to make sure we got it all. So if you guys didn't see Marianne's question, it was, if you are not satisfied with a provider, kind of what do you do about it? And we really want to make sure you report the provider. You can report them to the insurance company. You can report them to, again, even if it's Medicare or Medicaid, you can definitely report providers there. And then also in their office, ask for an office administrator, as far as a supervisor, office clinic director. Somebody is there to manage the trouble with anything that happens in that office. Ask to speak to them, request follow-up communication from everyone. Make sure that issue is documented at that office leadership level, at your health plan level, because what happens is, if certain providers gets lots of complaints, your insurance company can determine if that is a safe provider for them to be able to keep on board. I used to be a part of the Trillium world, and we would have people complain, and then we would reach out to these providers and they would have horrible treatment. Okay, this person might not be able to stay in the network of providers, right? What do we do to help keep people safe? We can take them out of the list of ... So again, report, alley through and looking at your licensing boards, social work, psychology, licensed mental health, MACBO for people who have QMHPs. Look at your board of nursing. They have, anybody who has a license has somebody that says, okay, this is not acceptable by our standards. We're going to treat you different. Your insurance company might not punish you, but your licensing board can definitely smack a hand, and we don't want the licensing board smacking our hands. So we typically will straighten up, fly right, making sure we're doing what we need to, because those folks will hold us accountable. So that's my last little tidbit in there.